All right, welcome back to our mini-series on low back pain and sciatica. Again, my name is Dr. Andrew Gurecki, and we're finishing up the series here talking about the top 3 types of low back pain. We know that 80% of the people that walk in the door with low back pain or sciatica have these 3 types. Now, we know there's other types. There's many other types, but 80% of the time it falls into these 3 categories. Number 1 is a disc bulge or herniation. And this is something that shows up on an MRI, but also we can diagnose or understand if somebody has this simply by asking them what their symptoms are. So if the person is under the age of 35, we know that there's an 85% chance that a disc bulge is going to be occurring because that is what the statistics and research shows. We also know that if the person has pain, numbness, and tingling down the back of the leg when they cough, laugh, or sneeze, and it's worse in the morning, those are the indicators that somebody has a disc bulge or herniation. If it doesn't get worse in the morning or when you cough, laugh, or sneeze, and if you're over the age of 35, this is probably not what you have. Now we know that there are studies that now show that 60% of people over the age of 50 do have a disc bulge, but there's a really good chance that that's not what's causing their pain. So keep that in mind. Second type of low back pain is SI or sacroiliac pain. And this is something that affects all ages. It does not discriminate. It's very common in women who are pregnant during and after pregnancy because the pelvis is unstable due to hormones. We also know that the symptoms can be very localized to one side. You can actually push your finger or your thumb right on the spot. It usually hurts when we sit or lay down, and it can cause sciatica in severe cases. The third type, which most of you that are listening have, and the reason that you have that is because statistics and research show that if you're over the age of 55, you have pain with standing or walking that is relieved with sitting down. There's a 97% chance you have stenosis or what's otherwise called as degenerative disc disease or arthritis of the spine. And ultimately what happens here is as we age, our disc becomes more narrow. That's natural. We lose height. The disc becomes dehydrated. It causes the hole where the nerve comes out to get smaller, and it allows us to be more susceptible. Now we know that stenosis can be treated and you can have it without pain. In fact, 80% of people that are over the age of 60 have stenosis, but not all of them have pain. So it definitely is possible, and we see lots of good things when we work with people in the physical therapy world. So I hope this helps you understand the top 3 types of low back pain. That's important to identify the sciatic symptom, but really what the type is. And then the next step is identifying what the cause is. What is the cause of these 3 things, which is different than the type? You might be wondering, why in the world are we giving away this mini course and we're trying to share all this information with you? And I really just wanted to clarify and just full disclosure so that we can build trust. I've been there before. I've been a back pain patient, and I've gone through every possible treatment that you can imagine. And just like we talked about in this video, really altering the problem is really what I was given. So medications, injections, surgery. Actually, I went through surgery myself. And looking back, and the surgery didn't work. And so, it was really discouraging for me, very expensive at the time. I was a college student, very broke, and I think I had to pay $30,000 of the expense. The total was $100,000, but my insurance did pick up some. But really what I'm here now, my mission in life is to get people the right information about low back pain and sciatica, and so that's what this mini course is about. And I also just wanted to throw out the idea that we're going to be hosting a lower back pain and sciatica workshop live that's about an hour and a half long, and we're going to cover the stuff that we just talked about in the first video, and we're also going to dive much deeper into the causes of low back pain, not the types, but the real causes and what to do about it. And so we're really giving away as much information as possible, and we want people to be informed, and we want people to get better, and we want people to get the right information. So I hope that you, if you're interested in learning more about the workshop, just click the button below this video, and you can learn about it. It's totally free, and hope that you consider. Thank you.